are massage and range of motion. These are things that, if they're recommended on your rehab handout, just recommend doing those as we have them instructed in terms of time frame. And when we're doing these, we want to, obviously have the pet in a comfortable position. You can do these laying down or you can do them standing up, whatever is easier for both you and your pet. But before you kind of start your massage, just kind of take a good inventory of things. The massage is only going to be done on the leg that's had surgery. So I'm going to do a massage on a front leg and a back leg, but if your dog had an ACL surgery, you're just going to be massaging the back leg. You don't have to worry about the front, and vice versa. So first thing I do is just kind of take a nice feel of the leg, and what you're feeling for are any tight muscles, because if we've got muscles that are really tight and really hard, we want to work those out because those are very painful. They can be like having a Charlie horse. And so just kind of feel everything and just feel, and you're going to feel the whole leg and up into the shoulder region and the chest and into the neck as well. When we're feeling muscles in a normal state, we want to kind of feel like our front arm. We want it to feel kind of soft but firm at the same time. I suppose I could equate that with like a rare steak, where it's kind of squishy, but there's a firmness to it as well. If you're feeling anything that's really rock hard and tight, those are the things that we really want to work on massaging out so that they're nice and comfortable. I also like to start at the end of the limb and work our way up, especially after surgery. If we're doing the light massage work and there's a lot of swelling in the leg, moving from the foot towards the heart helps to move some of that fluid and help to resolve some of that swelling issue. I know you see the treats. We're gonna lay down. Come on, lay down. Yeah, I know. We're gonna hide those. No, you can have one, but we're gonna hide them. Okay, come on, lay back down. There we go. So immediately after surgery, the first 3 days after surgery, we're gonna have you do a really light massage called effleurage. And with an effleurage type massage, you're basically just gonna pet them. It's just a real light skimming massage, working from the foot upwards, and you're just going to kind of move with the whole leg underneath and above. Yes, it's just a very nice pet, isn't it? Yes, that feels so good. Yes, that's very good girl. And again, working towards the foot, or from the foot towards the chest, and just kind of relaxing those types of muscles and things. We're not going real in depth because they just had surgery within the last few days. So just a real light petting massage. And if we're doing a back leg, again, foot, working our way up, and just kind of all areas of the body, and just kind of a petting massage. And we're going to work up into the hip and into the lower back as well. Yes, all right. So then the second 3 days after surgery, we're going to do a little bit deeper massage. So it's called a more medium massage called petrissage. And with that one, I'm just going to demonstrate on myself. When we're doing the massage, we want a little bit of a pressure. And so you want to kind of see the skin roll a little bit in front of your finger. So it's not a real deep massage, but we want to just see a little skin roll. And Miss Brea, can you lay over again for me? I know you're looking for these. Yeah, are you looking for those? You gotta lay over. Lay down. Good girl. All right. So with this one, again, foot towards the heart and just kind of a little bit deeper massage. I know that one's weird. Yeah, that one's weird. And with her, it's really hard to see because, oh, there you go. You can kind of see it a little bit better because she's so fuzzy. It's hard to see that skin roll, but you can feel it and you'll know how things look in there. And again, we're gonna massage up into the shoulder, the chest, the neck area. I know, are we gonna gaze into each other's eyes? Yeah. What do you think? Are you having a good day? Yeah, that's a good girl. And then if we're moving on, or if we're doing the back leg, again, yes, this might take a couple people, one to keep her distracted and one to do the massage. And so we're just gonna do a light, but a little bit deeper, I say medium pressure, massage into those areas. All right, and then after we've got sutures out, that's when we're really going to start to see some of those tight muscles. So we're going to do things that are a little bit more in-depth. And so those are going to be more of a deep tissue massage. And when you're working the foot kind of towards the elbow area, you want to do kind of a nice kneading motion and just work on, if you're using your thumbs on this side, you're using your fingers on the back side, and just kind of working everything to get it nice and relaxed and massaged. And you enjoy this one, don't you, Rhea? Yeah. And then when you're getting up into the shoulder area, some of these muscles, they run in more of like a longitudinal direction. So sometimes it's a little harder to do the kneading massage, and you're actually going to do more of a push and pull kind of massage. So you're going to squeeze and push and squeeze and pull, and it'll help work some of those muscles out. So it looks more like that, yeah. And get some of those more longitudinal muscles worked out. Same thing on the back here. And a lot of times when we're dealing with the front leg, you're going to see the muscles kind of back here be really tight. And you actually have a little tight one right there. So we're just going to do that push and pull massage, just working on that muscle to relax a little bit. When we get up into the shoulder area, it's hard to get around those. So we're just going to kind of do more of that kneading massage. And up into the neck. There. These are the ones they typically like. And then we're doing that shoulder blade again, kind of more of that kneading massage. So we're going to do up into the neck and the shoulder blade, and then we're also going to do kind of along the rib cage and that upper back area. Because all those muscles, when they're not using their leg normally, they get strained because they're holding their body in a different position. So all of those muscles can get fatigued and they can get tight and they can kind of feel like a Charlie horse in there. So if we can get everything just kind of all rubbed out, they'll feel a lot more comfortable, and a lot of pets will actually start to use the leg a little bit better. And then don't forget to massage up underneath in here, because we can get some tightness under there. And again, we're kind of doing that push and pull motion under there. Yeah. What do you think? Did I find a tight spot again? Yeah, that's a good girl. So that's our front leg massage. If we're doing a back leg massage, again, anything kind of from the foot up to the knee area or the elbow in the front. I know you see the treats there, don't you? You can have one more. We're going to hide them. Okay, but you got to lay down. There you go. Good girl. There we go. So again, working our way down. I know you saw them again. That was my fault. All right. So again, that kneading massage, you want to see what I'm doing here? You can see it. And just working on all those muscles. Oh, there we go. You're pushing into that one. You like that? Yeah. That's a good massage, isn't it? Yeah, so just kind of working in those areas. And feel this calf area. A lot of times after knee surgery, we'll feel this area get kind of tight. So you want to work on that muscle. And this one, you can kind of use that kneading motion or the push and pull. That one works both ways. When we get into the thigh area, this is again one of those push and pull type scenarios where they tend to massage a little easier. Also, it's much easier when you get your hand into the inside of the thigh and you can work those out. Be very conscientious about feeling up into the groin area when you're assessing, because a lot of dogs will get a lot of really tight groin muscles, and those can be very, very uncomfortable. Yeah, I know I'm petting your area down there. So you really want to check those muscles very regularly. I like to do a massage 1 to 2 times a day minimally, 2 to 3 if you can, if your pet will be amenable to it. And you know, we realize that you do have a job and you have things you have to do, so sometimes that just doesn't work. But as often as you can do it is going to make them more comfortable. Okay, bring your leg down, please. All right, so we've got our massaging motion up and down here. That push, I know those are a little tight back there, aren't they? Just go like this. Good girl. Yeah. You just kind of work them real gently and real slowly. And then you're going to massage kind of that kneading motion up into the hip area and into that lower back. Yeah, we just want to get all those muscles nice and loose. Yeah, nice and loose for you, baby girl. Good job.